What I believe is a very important factor are mainly two things: how we upbring our children, and the rules at home and the rules that we teach our children, how we motivate them to have life, to be working hard to get something, and to work on this and develop these skills that you have to work hard in life to get something.
Dr. Darwish, welcome to the show. To get started, could you maybe tell us about what your understanding of addiction is? And I've heard you say elsewhere, and I might be misquoting, but I'll just say it anyway. When someone is an addict, all they've done is taken a directional error. Could you maybe expand on this?
Well, first, thank you for having me. And The understanding of addiction, from my point of view, is it's a whole lifestyle and a whole dilemma of choices that's always leading this person to be connected to the lifestyle and the choices of leading and nourishing his addiction. And So when we are trying to understand where is he going, what is he doing, so the direction thing is that's always leading in the direction of his addiction, as choosing the lifestyle, choosing the work he's doing, choosing how he's getting the money, choosing how he spend his money, choosing how to spend his time. It's always in the direction that is serving the addictive behavior, the addictive attitude.
Wow. So it's really the person's whole life revolves around whatever the addiction is, whether it's drugs or alcohol or food or whatever. That's the becomes the central focus of the person's life and their activity and their drives.
Yeah, that's because, and that's why when we are talking about pharmacotherapy for addiction, if we take replacement therapy or even the antagonistic therapies, medication that can help the patients with addiction. Uh, the problem, if you're only sticking to pharmacotherapy, is that you're doing nothing with the lifestyle, with the way the brain is thinking. So maybe he will stop drugs, but then he will take a lifestyle of addiction for example, for sex, or for relationships, or for gambling. So it will not. It needs a holistic approach to try and work with addicts, to try and change the addictive mindset.
Interesting. And a quote I keep coming back to in this summit, this series of interviews, is one from Andrew Huberman. He's over at Stanford. He has this quote, which I think says a lot about addiction. It's basically that addiction is a progressive narrowing of what a person can get pleasure from. So all their focus just goes on in this one thing. And to me, then recovery is about expanding that into other areas that are going to provide fulfillment in the person's life. And that's probably what you do with Recovery Egypt, which we're going to explore. Um, Now, am I right?
I'm sorry, with addiction, as in, it's that as if it's hijacked the brain. So all the motivation, all the life is just focused on how to do this addictive behavior. And other options, other things are not seen. Other even options that we have an option of life without drugs or without addiction. The patient can't imagine that this life can still exist.
100%. So it's everyone's got like this value hierarchy, and with the addiction, it's right at the top, and everything else is underneath that, and it's all oriented towards that. Now, am I right in saying that you, early in the 2000s, you worked at the largest mental health and addictions hospital in northern Egypt? Um, I'd be curious to ask about your experiences there and how that impacted your trajectory.
Well, the Mamora Hospital is the second or third biggest mental hospital in Egypt, and it is the biggest in the northern Egypt. So I was lucky enough to start my career there and to have encounter with hundreds of patients in very short time, and this gave me the experience and the um, work experience and facing a lot of patients with all diagnoses, psychotic patients, neurotic patients, and of course the addiction patients. When I started, the program for the addiction recovery wasn't yet well formulated. So it was always you see that patients coming in and coming out, and in total revolving door, they're just coming in and coming out. And this made me very curious. So how can we help them? How can we change this? And even the private practice at that time, when I started to go and have like shifts as a junior doctor there, I saw the same thing. It doesn't matter if you're paying a lot of money or you're not paying anything, just in the revolving door. And even when I asked a senior doctor at that time, so that what happened is the patient was going home and the doctor was telling him, okay, if you have any ideas that you want to use drugs, just call me. I asked him, okay, so if the patient called you, what are you going to say? He said, no, no, don't worry, he won't call, he will just relapse. And this made me really, very, very curious. So how are we helping patients if we are putting, you know, um, that they are going to relapse anyway? So why are we doing this job? So that dragged me to start and try and understand more about programs, about the NA and AA programs, and then about the CBT driven programs for addiction. And had to go first to Cairo, then all around the world, trying to understand more about this, and what does people do, what is the different philosophies of addiction treatment, and how can we implement this in Alexandria and in Egypt.
Interesting. Now, I've heard that you didn't start out with the intention of becoming a psychiatrist. You were actually on track to becoming a cardiologist. Is that right? Why did you make that change?
Well, simply my paperwork was lost in the Ministry of Health. So, yeah, I wanted to go to a very special place for cardiology, and I admitted all the papers and got all the papers signed and all the agreements done. And then I don't know, until now, I don't know what happened with my paperwork. So I had to change. Yeah.
It's amazing. Just like I had no idea that that was going to be that was why you made the change. But the amount of lives that have been benefited by that mistake or whatever is incredible. Thousands and thousands of people's lives have been changed because of that. So, wow, that's incredible. So, is there anything, Dr. Darwish, that you believe about addiction that would go against the conventional wisdom in your field, in the field of psychiatry? Anything that you know about addiction from your experience? Because I know you've been in somewhat in the trenches for a long time. Anything that you believe that most people in your field would disagree with?
Yeah, mainly two things. Number one, that addicts will always be addicts, and they can never be treated. Let me just put a hint here, because in Egypt we don't have replacement therapies. We don't have methadone or buprenorphine, so we are totally dependent on complete abstinence. So in a lot of people mind, that addicts will the best thing that they can do is replacement and just live with this, and I don't believe in this. The second thing is that they are undependable. You cannot depend on people who have addiction problems. And again, I don't believe in this. If you say that you're saying that recovery is an interesting model, is a successful model, I would say that the backbone of recovery are ex addicts, are recovered ex addicts, and I trust them literally with my life, and they now control the accounting part, the managerial part, of course, the therapeutic part in a lot of our activities in recovery, and I really trust them with my life.
That's super interesting. Now, you've worked with probably thousands of people in recovery, and obviously there are many different causes of addiction. But are there any that you notice that are very, very common, like maybe the top two or three, for example? What have you noticed to be the main causes of addiction in the people that you've worked with?
We cannot ignore, for sure, we cannot ignore the effect of genetics and hereditary things. But these are things out of our hands. But what I believe is a very important factor are mainly two things: how we upbring our children, and the rules at home, and the rules that we teach our children, how we motivate them to have life, to be working hard to get something, and to work on this, and develop these skills that you have to work hard in life to get something. And the main other main thing is the community, and the effect of the community, the effect of the economic well-being of the community in general, and the norms of the community. For example, in Egypt, it's, I wouldn't say it's normal, but it is culturally understandable that people can use cannabis. Okay. Now, in a lot of places, cannabis is more legal, and Egypt is not legal, but culturally, it is accepted that people can use cannabis. So you will find that the dependency and the addiction percentages for cannabis use is very, very high. But it is not acceptable to use heroin, for example. So people using heroin will be, taken out of the community. We will be always looked at as these are hardcore addicts that people wouldn't trust or wouldn't like to deal with. So these are, to my understanding, are the two main things. And when you're treating, you have to fix this at home or at the community that you're bringing the patient back to. If they come back, finish treatment, and then they come back to this, no to this community or this house, or with the same rules, they will very, very, very liable to relapse. Of course, you cannot change the rules of the community, and that's why, in the treatment perspective, we always thought that building our community, our safe community, that our people and our patients will come back to as a safe place, even if they're dealing in a community, for example, even if they're dealing in a community where cannabis is normal, but then their main connection is to the recovery community. So their norms is there, even if they go outside and then they come back grounding, and their norms are there.
So it's almost like an oasis in the desert.
Kind of, yeah. Yeah.
I just want to touch on what you said there about the family and the rules within the family and the importance of, I think you were saying that there's a big importance of, like having a direction for your life and working hard and delaying gratification for these long-term projects. Is that sort of what you're getting at? For like, if someone has that, they're less likely to become addicted. And then with addiction, it's really just the inability to delay gratification and just get things instantly without this effort, and that is a big problem. Could you maybe expand on that a little bit?
So for people, um, addiction in general is to get a very strong gratification in very, very short time. And even if you're having a problem, you're just neglecting this problem and using drugs to get high, or to, pass the day without focusing in on this problem. Sometimes this is, like people with procrastination. It's not that they are lazy. It's not that they are doesn't want to do things, but they are very anxious of, am I gonna succeed in the other thing, in what I want to do. So addicts are the same. They feel that I'm not good enough, So I'm not going to succeed in life. I'm not going to succeed in this relationship. I'm not going to succeed as a worker or a husband or whatever. And so it's better for me to have drugs and just live in this place where my mind, in the back of my mind, I'm telling, oh, if I just stop drugs, then I'll be good. Then I'll be successful. But in the core, they are really anxious. They are really afraid of being successful. We have treated a lot of people who have, for example, family businesses, and their parents, just waiting for them to be sober and to be good, just to be the managers of a big company. And one day I was talking to this guy, and he was telling me, so when I finish treatment, I'll just go and be and hold a managerial position in my father's company. I told him, so what are your credentials to be a manager? And he said, I'll be sober for a year. I told him, okay, being sober for a year is just the baseline of every other human being. So why do you deserve to be a manager? And he just couldn't get the idea at that time that, okay, I cannot. Why not? Why not? I did a very hard job of being sober for a year. Then I deserve to be a manager in this company, and it's a completely different world. So you deserve to celebrate 1 year of abstinence, 1 year of recovery, but you don't deserve to get a managerial position. And if you get this, it's as if you got it without working for it. And again, we'll be rewinding the addictive process and the causes that cause the addiction. You know, yeah. And actually, what the plan at that time was to take some of the advantages that he got. At that time, he was maybe 6, 7 months recovered, and at that time they get some vacations, phone calls, and so on. So we decided that, okay, you need to learn how to work hard, so we will take some of these advantages off you to just to understand that life is not as easy as you think.
Yeah, no, that makes a lot of sense. I've heard someone's, I can't remember the quote. It was something like reciprocation is the number one thing in human life. This idea of give and take, and this idea of, you're rewarded for your effort. And the further that someone is taken off that sort of cycle and they sort of lose touch with that because they're just keep on getting things without any effort, I think it can never end in a good place. It leads, you're just cut off from reality. But the closer you can get into that cycle of reciprocation, the more of it.
because because in their upbringing, most addicts are used to get things that they didn't work enough for. When they start to be recovering, and any simple situation, quarrel, or misunderstanding with their family, they would say, oh, you're abusing me, or you are misunderstanding, you are um, misjudging me, and this is not fair. And this is giving them ideas of relapse. There is theory called just world phenomena, that we always think that if I do good thing for you, then you'll do good thing for me. This is a just world, as it should be. And actually, it, I love doing giving this group that world is not just in this way. So it's justice is not the justice that you have in mind. God's justice is different from our calculations. So if you think that, yeah, you did this in a good way, you didn't have any drugs, and for example the family is saying, oh, you look different, maybe you relapsed. Oh, this is not just, and I want to go to relapse. Then you have to learn that not all the time you'll have just, not all the time, sometimes you'll be totally fine to doing all what you have to do, but then you will not get what you wanted, and this is totally fine, and this is totally normal. But then in treatment you have to teach them and train them on accepting this.
No, that makes a lot of sense. Now, you've started something pretty incredible called Recovery Egypt. Could you maybe tell us about the story of how this started and its evolution?
Well, on maybe 2005, 2006, we were just me and my partner were thinking about, as I told you, that the addiction services is not um, good enough, comprehensive enough. There are a lot of unethical practices going on, and that what gave us the idea. Okay, let's try and do something to help people. And we started with an outpatient group that was twice weekly. Um, well, but by now's currency, you would say that we charged like $5 a month for a patient to attend all the 8 groups. Yeah, to try and help people. And then afterwards, we in 2010 we opened recovery as a facility. And then we first started as a rehab, only rehab, for maybe 4 5 years, 8 years actually. And then we opened the detoxification center aside of the rehab and the acute treatment, and then the outpatients, several outpatient clinics. Um, and now we opened a couple of rehabs that's again helping, less fortunate people to try and give the same quality that we are giving with high end, with the lowest possible cost. And we expanded this also to psychotic patients. So we are doing work with the CBT for psychosis to rehab psychotic patients and help them to regain normal life.
And the
Through
impact.
this,
Sorry, I was just going to say
yeah,
the
through
the
this, yeah,
you
go
go,
ahead.
you go. It's okay. You go.
I just was saying that through this, most of our team has been treated with us in the beginning, and then they developed so treatment, follow up, and services, and then to start working. And now most of the therapies, the therapists in our team are ex addicts or even psychologists that have been trained with us since they started their career, and now they are, like having the big family all the time.
Amazing, amazing. So I want to sort of draw people's attention to a couple of things. So it was just you and your partner that started this, and you were doing everything at the start. You were painting the walls. You were, doing all of the every different work. You were organizing like barbecues and all these different things. And you've grown this to something now that I'd like to know more about the results. Like when I heard your interview with our friends Richard and Matt at the Science of Psychotherapy podcast, you mentioned that you would, at these breakfasts that you hold, you talk about the years of abstinence, and you had something like 460 years of abstinence back then. You've probably got a lot more now. And on the website, I can see that more than 1,000 people have recovered through your service as well. So can you tell us more about the results of what you've been able to accomplish with this?
Well, in the Muslims, we have the Ramadan and we have the breakfast of Ramadan. So it's a cultural thing in Egypt and I think all over the world, and that people would like to come and have breakfast together. So we started this tradition since we started, and now I will send you the photo of the last year. Um, the people there, and it's most of the team, as again the team, most of them are our recovered patients, and the people who have already recovered, they come and for this breakfast. So actually last year I didn't calculate because it was like uh, I was making the move to coming to UK, so everybody was there just to say bye for me and and wish me luck for the this step. But I think now the breakfast, I believe, would be at least 800, 900 years of recovery if you add up all the years of the people there. Um, and the nice thing about it is we now have, my daughter always say, Puppy, you have a person everywhere, because whenever we want to go and do anything, or she needs anything, or the family needs, and I'll just phone call somebody and tell them, okay, I need this, and the thing will be done, even without going. And because we have, like, I call it our secret community, uh, all over Alexandria. Yeah. Uh, yeah, and the nice thing is that people do services to each other, so it's like a supporting each other, even if a person who, for example, an engineer, a newly grad engineer, and he just finished recovery and he needs work, so other engineers who have been recovered for some time, they would take him and help him to, and train him to work and develop himself. And this for me is amazing, because it's an ongoing process, even if I'm not there anytime, and it will always be there, and it will always be uh, building, and has continuity in itself.
Amazing. And this goes back to what we were speaking about earlier about reciprocation, because you have given so much to these people's lives and this community, then you're able to ask for things whenever you need to as well. And this is in a really healthy form. Now, your approach strikes me as highly unique. I have never seen a recovery center that offers what you guys offer. So could you maybe tell us about some of the unique characteristics of Recovery Egypt versus other centers?
Well, maybe because we started this when we were younger. Now I'm 46. My partner is 48. But we started this last 20 years ago. So people now, in even in the breakfasts now, you'll find people coming with their families, with their kids. So the family, so we're treating them as, younger brothers and sisters, and they it's as if the family is getting bigger and bigger, and giving personal attention for everybody, even through the years. It always gives this spirit that it's not just about treatment. It's more than this. It's about our connection. It's not just treating and full stop. It's no, we have something that we want to pass forward, and the people working with us, they get this sense. And this is the best thing that we have, and I'm assured that this is completely different thing from any other place. I'll tell you, for example, we were once in a conference, maybe a couple of years ago, and some doctors colleagues were talking about having good psychologists in their practice and so on. I was telling them, do you train them enough? And they said they have to be trained on their own. And I said, no, they don't. You have to put effort in training them and teaching them how to do the work. And if you want, I can offer you some to come to your clinic and work there. If you want, we can send you a couple of people from our team to go and work with you. And he said, okay, but aren't you afraid that I will take them in my clinic and work for me? I told him no, because I know it's my people. They are very loyal to us, and you will never be able to compete, even if you give them more salary, but you'll never be able to compete with the spirit that we have, with the work atmosphere that we have, and with the support that we give. And this happened. I sent this an addiction therapist and a psychologist to work with him. Again, because we are used that people would talk to us openly and even contradict with our point of view or our plan. But when they did this practice with him, he couldn't understand it. I'm the doctor, I'm the consultant. Why are you saying things, against my will, or just discussing with me my plan? And this is our culture in recovery, that it's open, that you can discuss this with even with Sherif or Wael, the head of the place. Anybody can just call and discuss the case with us, or challenge our decisions with anybody. And this built something different.
For sure. It sounds very different. And out of all these different elements and things that you offer, like, what would you say is the most important? What's the most important element that helps the people that come to you recover?
Working from the heart, and be able to and be very truthful with yourself. There was something that was very strong in the beginning of our practice between me and my partner. His name is Wael. That sometimes people would come. For example, this guy is my patient, and he's coming, but he didn't like working with me, or had a clash. Like I'm taking a decision, and he doesn't like it, and he would say, "Oh, I want to work with Dr. Wael," and I say, "Okay, you go ahead." And then he would go there, and while we'll make the same decision but with a different way of putting it through. And the guy at the end he will do what we wanted to do. But being able to say, okay, it's not my part now, it's your part, and I like pass the ball to you, and you do your job, and then I know that you will pass the ball to me, and so on. So when we opened the detoxification center, so we had to hire some doctors extra, from the one who were with us from the beginning, and the ones who continued working with us were the ones who were able to do this part of, you have to refer in order to have more money, and you have to refer in order to be a team player, for everybody. And until now, nobody can understand this, that if you have a case and you refer it, you'll get more money than keeping the case with you. For the people who are, confident enough and are able to, yeah, this is not my part, this is not my. For example, we have people working with OCD, people working with psychosis, people working with addiction. So if I'm the person working with OCD and I get an addiction patient, I should refer to the addiction team. Okay. When you just work with the addiction patient, although you are an OCD expert, for example, then you will lose the patient because you're not going to give him the best service. But if you just pass the patient to the addiction team, to the team more specialized in this, the patient will benefit. He will be in the system for more time, and he will get better. At the end, financial wise, he will pay more money. This money will circulate to everybody, and you will get your part, which is less than having the patient all for yourself. But at the end, the patient will stay for longer, and he will benefit, and you will get better results, and you get better word of mouth advertisement for your work. And everybody, it's a win-win situation for everybody.
That's incredible, and it seems that at the heart of that, it's a mindset of abundance, instead of scarcity, and you can only really sort of have that kind of trust between the people that work there if, as you say, that you're working from the heart here. You've got the patient's best interest at heart, not what you're trying to achieve individually. And what you've done there to create that kind of culture and that kind of atmosphere is unique. So that's really something special that you don't hear about a lot these days. So I hope we can read. I can't wait till you write a book about this, Dr. Darwish, so people can learn more about this and maybe get other centers set up in around the world like this too. Um, so your team involves psychologists, psychiatrists, therapists, life coaches. Why does addiction require like this integrative approach?
Because if you go to the beginning of what we were talking, it's not just a problem with neurotransmitters or the motivation cycle, or it's everything. You need to work with the patient to, because if you have, for example, say a 30 years old guy who is been addicted since he was 17, 18. So the amount of skills that this guy have in real life is very scarce. He's very good in getting drugs, in manipulating people, in manipulating his family, but he doesn't know how to write a CV. He doesn't know how to ask for things from the basics. He doesn't know how to identify his problems, identify his emotions, express them, relationship with himself, relationships with others. So you, at this part, you need more psychologists and more therapists to work with this guy. And then maybe he's married, so he will need a marriage counseling. Maybe he wants to work, so he needs to work with a psychologist. Maybe he needs someone to he's studying, so I usually do a couple of sessions about how to study, how to go to an exam, and how to study for an exam, in order to pass without cheating, without all the tricks of the cheating that they used to do, which is against the program principles. So how to do this in the right way? So that's why you need all of this team to be able to handle it in the right way.
It strikes me that this is what society needs, not just for people in recovery from addiction, but just in general. Like a place, if you're in a difficult spot in life, you can go, and there's a whole different team from a wide. They've got a wide range of skills that can help you for these different problems that you have in life. Like that's, you don't need to go see a psychologist or an individual. You need this ecosystem, this community, and if that was there, I think that would be such an amazing thing. Like if there was something like that in your town or your city or whatever, you know. So it's, yeah, you've got to expand this.
What I'm trying to do now to expand this is trying to make a YouTube channel while I'm here, because here, because of the the routine work 9 to 5, so I have much more time than I used to have in Egypt. So I'm trying to pass this forward through doing videos on YouTube. I just started this a couple of weeks ago. See where it goes, but I think it's an exciting thing to do.
For sure, for sure. Okay, can you tell me about um so you work with people that would come from a wide range of backgrounds, and can you talk about the your ability to predict who's going to recover and who won't? Like, do you have any kind of ability to do that?
Well, in the beginning, when you see a patient, you never have. I personally gave up on trying and saying this guy will recover, this guy is not, because you never know. It may be a very simple addiction story. On the addiction severity index, it'll score very low, but this guy, because he didn't, for example, get rock bottom, he will not be uh, motivated, he will not be cooperative, and he will not recover. And maybe he rehabs 1 or 2 years before starting to recover. And you would get a person who has a very, very bad ASI and index, and then by working. So I always say that as a recovery, we are just like the train. If you want to get in, we are most welcome, and we will give you our 100% all the time. But if you just don't want to do it, we will still be working with you. We will still be, if you don't want to do it inpatient, we can help you from outpatient. If you don't want, if you have to travel, we can do it online. If and this is another expansion that we are trying to do, is not to limit ourselves to geographically same place. We are trying to expand this to different places and to doing online services. um, at the end, if you get motivated enough and serious enough, you will just try and get into the cycle. We always say that everybody wish that they are sober or they are abstinent, but wishing is not enough. It's the decision. And the word decision means that there is action in place. So you're always revising our decisions of recovery, and revising it by linking it to the action that we're doing today. Just for today, or here and now concepts is more or less the same. But okay, what do I have to do today to stay abstinent or to stay sober? And if you do this, then yeah, you are recovering. If you don't do it, even if you're not using the drugs, but still you are in the addiction process, what they call a dry addict. because you're not doing what you're supposed to do to protect yourself, to develop yourself. And this why you're always in a changing process.
Interesting. And something that you said in that interview with Matt and Richard, which I really just want to link with here, is just that you give 100% to everybody because you've no idea. You've no idea who's going to recover and who's not. So that's just your default, and that's a great philosophy too. You know, um, and you touched on it there as well. You know, but what I want to really draw attention to this, your idea of recovery. What does it mean to you to be in recovery, and do you consider yourself in recovery, for example?
Yes, yes. I do consider myself always to be in recovery, and all and everybody, and that's why we chose the logo as a butterfly. So the butterfly, it expresses change, and we're always in a recovery process all the time. So we're always changing, we're always developing from one place to the other. Even when I did the TED talk, it was also about change. I'm very fascinated about the idea of change and how we can change from one person to the other, from one character to the other. And so recovery is an everlasting, evolving process that we work with, and we can develop from. Um, if we stop recovering, then we're going down. For any human being, if you stop developing, then we are going always going down. And this is, when I started working here, um, uh, an interesting thing happened, because for me this move was heartbreaking in a way. I'm leaving my place, my people, and my big family for my small family, for my daughters and my wife. um, but I was really anxious. Am I going to make any change in an NHS system, in a very, very well established system? And the good thing, after maybe 5 months of working now, is that I'm starting to feel the change. I'm starting to feel that even the team around me is starting to change, is starting to develop new attitudes, is looking and working with me in a bit different way. And I'm getting this motivation even from my managers, that yes, you're making something different, you're doing something different. um, so I think that yes, recovering and change and developing yourself, and the surrounding around you, is something amazing, and something that, um, for me, is the thing that's keeping me alive.
That's so interesting. So you've went into the NHS and you're working in there now in a completely new environment, new people, new team, new culture, and you're starting to see after 5 months that you're able to have a bit of impact, which is fantastic. But I'm curious how you approach that. Like, how do you? I can't imagine that you initially went in there and said, "Okay, we've got to change this, we've got to change that." How do you get people on your side to start listening and making changes, because that is not an easy thing to do.
Yeah, yeah, you bet it isn't. And the thing is, I was very curious to understand what's happening, what's going on around me, and the team is very, very nice people, and they are very helpful, and they help me to understand, what we are doing, what's needed from me, and then I started to observe, because, and again, I would say that recovery has a favor for this on me, that I'm very proud to say that what the people here are doing, we have been doing there in Egypt, with all the complexities in doing this in Egypt. But having different teams, dedicating the teams for the services, the referral systems between the teams, all of this is done here, and this is the core of the work here. And one of the guys, the consultants, the other consultant was saying, "Oh, it's completely different." And I tell them, it's for me, it's not that different than in Egypt we call them by names. Here you call them by the names of the people, but here you call them, well, by the name of the team. So just I'm trying to learn the abbreviations of the team, but it's all more or less something like what we have or what we built there, and this making it made me very very proud. Um, but the good thing is the people there appreciated that I've been a psychiatrist for 20 years, so I've seen a lot, and they really appreciated this, and they were very helpful and very supportive. And when I started to, recognize some things that I can work on, like the teaching, for example, I love this. They allowed me to do this and to have the impact in this, and this is starting to move things around and change things. And by doing this, other consultants are, more eager to do things, and so the wheel is turning, and things are going to a very good place.
Fantastic, fantastic. All right, so am I right in saying that you guys use sort of a stages of change model whenever you're in some of your approach? And that involves the pre-contemplation, contemplation, although I think you use a different word for contemplation, preparation, action, and maintenance. Could you maybe tell us how you get somebody to move from that pre-contemplation stage? Like, what do you find really effective for getting someone to make that initial change from pre-contemplation to decision, as you refer to it?
Right. So first, I'll tell you about the stages in recovery. So this is one of our secrets, but we link it like, wheels together. Uh, l- um, so there is the wheel of motivation, as you said, the pre-contemplation, contemplation, and so on, and there is the development wheel. So the understanding, the change, the fixing of change, and the development. And there are other ways that we link all of these, like a drawing for the patient, and we try and see where is he in the motivation, where is he in the change, and where is he, and so on. So if for example I'm pre-contemplated to something, so I'm not interested in change, I don't see any reason why would I change. So if you tell me that what you are living is bad, for example, if I'm using drugs and I don't have any problems, I don't have any legal problems, any social problems, so why would I stop this? If you just start and tell me, oh, it's bad for your health, it will make you this and that, it can make problems, an addict mind is always, no, I'm more clever than this. But we can use the curiosity and the impulsivity in the addict mind to try and move him from not thinking about stopping or abstinent into thinking about abstinent by showing him good things that are in the abstinent life that he misses, without telling him, come and play with us, just watch us playing. And this will start to motivate the people. Okay, I want to taste this. Okay, in order to taste this, maybe you will need to do this and that, and then he'll do it. I'll tell it to you in a very nice example, a very funny example. So I used to play volleyball. I think you heard this with Richard also. So we have a volleyball court in recovery, and we have this Tuesday match that's very, very tradition with us. And so a new patient who's still pre-contemplated, doesn't want to stay, he doesn't want to be treated, he would, on Tuesday, he would find people coming from outside, and he would find me in sportswear, Wael in sportswear, the doctors who giving sessions now. We are totally involved in playing, very anxious about playing, very, very involved in it, enjoying it. People screaming, people, and they would say, "Oh, can I join?" I would say, no, you cannot, because you need to play through the weekdays in order to be able to play the Tuesday match. And sometimes they would just, give it a couple of weeks in order to be playing, even if they have, like people who have played basketball or handball, they would have, how to do volleyball. But then we say, no, you cannot play, you will have to stay stay on the line until you really know how to play. And this, we move them from the pre-contemplation of staying in recovery to a bit of, okay, maybe I want to stay. And this is the ambivalence of the contemplation, just by seeing things that he doesn't have, and he would be interested to try, and he would be interested to have. If we satisfy this immediately, we'll be doing like his family. Just satisfied, and he will not enjoy playing with the, with a higher standard. He will not enjoy it, so he will just say, no, I don't want it. But when we give it more work, you'll have to work on this and work on that. And what I do sometimes, a bit mean trick, is that I would, in 3 weeks' time, if I found this person, more interested in playing, I would take him personally and try and teach him how to play the ball, how to do, some, and they would be very happy that Dr. Sharif is teaching us personally how to play, and this is a very big motivation for them, to okay, I'll have you on my team this time, and so on. And you're giving the motivation a bit by bit, moving them in this cycle, not only by therapy, like proper sessions, but all in the community. And this is how we say community as a therapeutic method, that joining the community, joining all of this life, will make them very curious. Okay, what's on the next level? How can I go to the next level?
So interesting. So it's sort of like what we were talking about at the start, where the addiction for someone is their only reward in life. Whereas whenever you're exposing them to the volleyball game, you're exposing them to natural rewards, natural social rewards, and they start to go, oh, they get curious and they go, maybe I would quite like that, And then they come and say, oh, can I play now? You say, no, no, you have to wait, and then you delay the gratification, so they realize they have to earn it, and yeah, that's amazing. So can I ask, for anybody that's listening to this that's really inspired by your story, like I'm really inspired by your story, right? But anybody listening to this that's really inspired by your story and they have a dream of making a similar kind of contribution where, like, setting up a center where people can get this kind of help, doesn't necessarily need to be an addiction, but just from your experiences of setting up and running Recovery Egypt, have you got any sort of words of wisdom or any words of advice for someone that would like to do that someday?
Yeah, you asked me in the middle a question I forgot to answer, in the context that what was the amount of effort that we did in the beginning. So the amount of effort was not only that we painted the walls, but we had to give up our weekends, our, even New Year's, our Eid vacation, to just be with the guys, with the patients, and to go out with them, protect them, help them to enjoy a day without going and using drugs. Even in Ramadan, going to prayers together, and all of this. And colleagues would say, "Oh, why are you going out with your patients?" It's not going out with the patients, rather than giving them um, hope and example. At that time, I had a goatee, and well, was, he had his haircut. So like, half the patients would go cutting, removing their hair, and half the patients would have a goatee, just, even to look like us. um, and if you want to do something like this, I think it's delayed gratification again, for yourself, that you will have to give a lot before you get something established and stable. Um, Maybe in a nutshell, it's the opposite of us, the startup thinking, that we have to start and grow very fast. I think it's the opposite. You have to take it slowly, and you have to make sure that every one of your team, everyone working with the patients, the recovering, and you'll find the example of recovering patients working in that place. It's a very common example in the addiction world. But you have to make sure that your ex-patient, that is now your therapist, is treated enough not to mess with others people's mind, because um, you're gonna trust them not with your only with your money or your career, but with the people's lives. And you have to make sure that um, you've done your work very well with them. You're still supervising them. Yesterday we were doing supervision even from here on Zoom, and we were doing supervision for all the team, and you're still supervising this, um, making sure that you're giving it from your soul. Addiction treatment or psychiatry in general, I don't think it is a job that you can do just, superficially. You have to get it. It will take from your soul, but it will give you a lot. It will give you a lot. Um, Spiritually speaking, I don't mean money speaking, but spiritually speaking.
That's very well said. So just one question now to wrap up, Dr. Darwish. If you could get a letter to everybody in the world that is currently struggling with an addiction, what would be some of the key points that you would include on that letter?
I would say, I know how much you are struggling. I know how much you feel the pain. And I know that inside there is a great person, and there is a person that can, the limit is the sky. But right now, you need to have the help of somebody, because how your brain is working right now is not working to help you. It's actually working to hook you up more and more with the addiction. Treat addiction as if there is a being inside of you that is now controlling you, and you need um, the help of someone else to be able to activate your inner conscience, your inner strength. But if you're just doing it on your own with this monster inside, it's very hard to beat. But with the help of someone that you trust, you can beat it. And of course, it will take some time. Of course, it will take a hell of a lot of effort. But at the end, a lot of people done it. I've seen a lot of people done it, and I will send you a picture. Just try and blur a bit of it, and I'll be happy for you to publish it, to send a clear message that all of these people were just, these are the people who were able to come for that day. Not everybody, of course, but they are just the people who were able to come.
Incredible, incredible. Okay, so where can people connect with you online, Dr. Darwish? Where can they learn more about Recovery Egypt? And is there any other place you'd recommend people to go after watching this interview?
Sure, I will. I can send you the Facebook page, my Facebook page, the recovery Facebook page, and the website. Um, Again, I'll be happy if Arabic speaking people would like to join on the YouTube, and send me ideas that, or um, topics they want to discuss through this. Through this interview, I've had a lot of ideas that I want to share now on the YouTube thing, and I thank you for this. Um, yeah, and I'll send you my email if anybody want to contact us anytime. I'll be very happy to do this.
Fantastic, fantastic. Right. Well, I just want to wish you the very best with your work and your mission going forward. You're doing incredible things for the world. So all the best, and I wish you well in your new role in the NHS too.
Can I ask you a reverse question?
Yep.
Can can our model be done in the Western world?
That's a really good question. Um, I I think it just depends on the people that you have working in the center, and if you're able to replicate the kind of trust that you have in Alexandria, then I think it's certainly possible. I would love to see it, and if you if you do decide to sort of try and set this up in the UK, definitely contact me because I would love to see if I could contribute to that in any way as well. So
Well,
I think it could be done. It's all about culture, though.